You're listening to an archived Cabral Concept podcast. After listening to this show, check out the most up-to-date podcasts available at stephencabral.com/podcasts or search directly on iTunes. And now, welcome to the Cabral Concept, where board-certified naturopath and integrative health practitioner Dr. Stephen Cabral shares how he was diagnosed at the age of 17 with a life-altering illness and given no hope for recovery. It was only after studying and traveling all over the world did he discover how to combine ancient Ayurvedic healing practices with state-of-the-art naturopathic and functional medicine to fully rebalance the body and re-energize it with life. It's time to discover how to get well, lose weight, and finally feel alive again. And now, here's your host, Dr. Stephen Cabral.
Hi everyone, and welcome back to part 2 of our Cabral HouseCalls. Thanks so much for tuning back in. Hopefully you listened into yesterday's show. We answered so many great questions from the community. We went over made-up autoimmune-based diseases that they're giving names to. We went over whether coffee is allowed on the detox. We talked about histamine issues. We talked about ashwagandha. We talked about undermethylation. We talked about SAMe and N-acetylcysteine. What else did we talk about? We talked about Peyronie's disorder. We talked about acidity in the body. We talked about the CBO protocol, lower esophageal sphincter issues, and low stomach acid. Great podcast. Great questions from our community. And hopefully you tune in there. I did my best to answer them to the best of my ability. All right. I'm going to dive right into the questions. Hopefully it's not your first time tuning into the podcast. If it is your first time on the weekend host calls, welcome. We are going to answer our questions that have come in. They are answered in the line they come in, so in the queue that they come in. And these ones are from May 11th of this year. So about, what's that, about 10 weeks ago or so? May 11th through the 15th. All right, so looking forward to getting into these questions. I never know how many we're going to get to, somewhere between 5 and 10 in a show. And if you wrote in to ask Cabral, your questions will be answered in that 10 to 12 week mark. If you're looking for essentially same day answers, head on over to cabralsupportgroup.com. We are there to support you. My team and I will answer your questions right there. All right, so let's dive right into the show. I want to answer as many questions as possible. I really feel like we're on a little bit of a roll. I know sometimes I take a little bit longer to answer some questions, but again, I just want to make sure that I give people that second opinion of where to get started and what to do. Today's questions will be over at stephencabral.com/1255. And for all previous podcasts, please go on over to stephencabral.com/podcasts. Okay, first question from Catherine. Hello, I'm so glad to have come across your work. Before I did, I had seen so many naturopaths and medical doctors about my son's stools, which have never been normal, and it's clear his body cannot digest food properly. After numerous tests, we discovered he has Candida and various other bacterial overgrowth. Due to my son's age, he's just turned 3, I'm extremely cautious about following advice of naturopaths, using herbal remedies to treat his Candida. So far, we've done diet alone with Biocidin. That was until we found your protocol. I then realized he's too young to start on it. Do you have any recommendations for helping children with Candida overgrowth younger than 3? It's a concern that he will be living with this overgrowth for another year. Let me answer your question. Catherine, you can begin on it. Really, we recommend over 30 pounds in weight, or about 3 years old. So it's not that he can't do it at 3 years old. He absolutely can. We just are always cognizant of the weight of the child, the development of the child. And just like you, I'm a father of 2 young girls. And I've been using natural protocols since my wife was pregnant, meaning like with her. So obviously our child inside of my wife, cautious about what we use with my wife. So I've been using protocols since before they were born, right, for them. And I can tell you that we've had to do things like mold protocol, with my daughter. All 4 of us, essentially, I haven't talked about this, I will on a future podcast. All 4 of us got exposed to mold inside of our condo. Not ideal, not good. We're not happy about it, but we had a neighbor upstairs and sometimes a little absent-minded, and they let their dishwasher overflow, and they weren't in the house. And our entire ceiling from our kitchen all the way to our bathroom ended up getting flooded. And we didn't replace it because that was going to be a major ordeal and we have to go through insurance and all that. So we said, okay, it is what it is. Well, what happened was they had a second flood. Their tub is right above our tub and they let their tub overflow. Again, these are grown adults. I can laugh about it now, but not too happy. So our entire bathroom ceiling got destroyed. So we had to replace that. When we did that, we found mold. Not happy. Again, not happy, but these things in life happen. You can't control everything in life, but you can control your response. So anyway, my daughters are 4 and 6 years old. We had to do some of this. So you can use the protocol. Again, always use what you feel is best for you. I can never tell you what to do for you or your family, but I can guide you as to what I would do. And you can do it based on dosage. So again, you can open up the capsules for the Flora Film. You can dose at a smaller dose for the Biocidin. You can use all of these things at a smaller dose because that's how we meant it to be. All right? Thank you, Catherine, for writing in. And I know that you'll fix this, no doubt about it. And I wish you all the best. And I can't wait to hear both you and your son's success story. Okay? Judy's up next. Hi there. Can you please share how you recommend treating cuts and scrapes for your kiddos to minimize scarring and preventing infection? Also, I grew up using hydrogen peroxide to prevent infection. Is it bad to use for cleaning cuts? Okay. Judy, great question. Two schools of thought. Should you use hydrogen peroxide? It kills the bacteria for sure, but then does it weaken immune response as well as other things? Okay, couple thoughts around this. What are we looking at? What was the child exposed to? How bad is this cut? So for me, I know hydrogen peroxide works. If I believe that they could have gotten bacteria in that cut because of what they cut themselves on, I'll use hydrogen peroxide. Again, there's no straight and steadfast protocol. I can give you pros and cons to hydrogen peroxide. There's no doubt about that. But I'm not going to use antibiotic ointment. Would I use it if it was like infected? Absolutely, I will. So don't get me wrong. I will use everything at my disposal. Conventional medicine based, naturopathy based. Okay, but what do I do for my own kids? What do I do for myself when I get a cut? Right away, I'll wash it out with soap and water. That's what I'm going to do. But then I'm going to apply something to it that's naturally an antimicrobial, naturally an antibiotic. I'm going to give you a couple things because you can, again, choose what works best for you. You can use a colloidal silver spray. That's excellent as well. Highly recommend it. Conjunctivitis, skin rash, cuts, etc. Nutribiotic. I like the company. They're a great company. We use their products. Their nasal spray. We use their throat spray. We use their citrucidal. Well, they make a product for cuts and scrapes. And so you can check out Nutribiotic. 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 Okay. I'm not a lobbyist for a Nutribiotic, but they're a great company. And so what do I promote? I promote the best of everything. So that's what I recommend. What else do I recommend? We use... again, we're going to let it scab up. That's important because the scab is the protective layer that your body is using. And then we'll use things such as coconut oil. So not afraid to use that. Antimicrobial, keeps it moist as well. So the scab isn't just going to peel off. We'll do that. You can use a little bit of turmeric for sure. That's great. And the only other thing that I can think of that we use quite often is Manuka honey. So I'll put Manuka honey right on it right away because it's naturally an antibacterial and antimicrobial. So that's what we do. We let it air out at night while they are in bed. If it's a deeper one, we will keep it covered so we won't get it wet. We won't let them go swimming in a pool or in a lake while it's open and exposed. The salt water and ocean is fine. Again, in our opinion, it's a free flowing, so there's not bacteria in the same way. Yeah, and that's about it. And then the healing happens internally. So a lot of people say that it happens externally, but no, that's not true. The Manuka honey actually can help. But vitamin C, your vitamin E, important, your zinc, your glutamine. So basically what? Your healthy gut support, right? That's for the whole body. Or something like a beauty bundle, which is your zinc, it's your vitamin C, and it's your collagen, right? That's what's going to be great in addition to your DNS. If it's a child, well, my kids get daily fruit and vegetable blend. They get the DNS shake to their size, their weight. They get a little bit of omega-3s, a little vitamin C on a daily basis. So, I mean, that's what they're getting. So, of course, that's going to help as well. All right, great question. I probably spent a little long on that, but great question. All right, Katie's up next. Starting in my 20s, I would notice I got tired and I was sitting, my legs would jump involuntarily. Once it started, it would continue until either went to bed or got up and walked around. But walking was only temporary because once I would sit back down, it would start again. As I have gotten old and get tired earlier, the legs start jumping earlier at night. Okay, I can explain this. So I want you to look into restless leg syndrome. Just head on over. I'm going to see if I can type it in as well with you. Head on over to stephencabral.com/podcasts. If you scroll just a little bit down on that page, what you'll find is a search. It says search site. It's a search box. And just type in, I'm going to just type in Restless. Let's see what I come up with that. And what it does is it just pulls anytime I've ever talked about restless leg syndrome. All right. So leg muscle spasms, episode 246. And then I talked about it potentially on 267 and maybe on page 960. Okay. So here's the thing. Restless leg syndrome, typically short on magnesium. Sometimes calcium as well. Best thing to do, run a hair tissue mineral analysis. That will give you the best indicator possible, honestly. If you don't want to run a hair tissue mineral analysis, although I advise it, I would start using, and again, suggestion only, what I would do if I were in your position, but I can't tell you what to do. I would use either the deep sleep protocol, which is going to include some magnesium citrate. It will include some melatonin, but you could simply use 2 to 3 capsules of full spectrum magnesium on a daily basis. 1 at lunch, 2 at dinner, full spectrum magnesium. All right. And then you can move after that if you'd like to the CalMag Complete. All right. If that's the issue, should be good to go within a week or two. Ivana is up next. Long question. So I'm going to let everybody read that question today over at stephencabral.com/1255. I'll give you the short notes. Dear Dr. Cabral, I'm 23, diagnosed with Crohn's, started experiencing symptoms at 16, migraines, weight loss, bloating, extreme thirst, irregular bowel movements, stomach pain, and bloating. Doctors couldn't figure out what it was, said the blood work was okay. I cut out some of the foods I was sensitive to. Found out on MRI that there's already been damage done. I have a small stenosis in the terminal ileum, constant bloating, some liver enzyme counts elevated. Doctors say it's probably not a big deal. Very stressed with studying. I'm using some probiotics, VSL, curcumin, boswellia. Do you think a reason why enzymes would be elevated? Is everything okay for my liver enzymes? I'm based in Croatia, so I can't do any of the testing. Thank you for your time. Okay, so yeah, Ivan, I'm happy to help with this. All right. Never believe that what you saw on that MRI is what you're destined to live with for the next 60 to 70 years of your life. Stenosis can be overcome. Stenosis in the arteries can be overcome. So why couldn't it at the end of your small intestine? Right? I mean, without a doubt. So here's the thing. One step at a time. If you can't run a organic acids test to look for yeast overgrowth and a stool test to look for bacterial overgrowth, well, let's assume it's there. Again, this is up to you. I'm just giving an opinion of what I would do in your position. If you can't run the tests, well, there's a couple things you could do. If you have friends in any of the 19 countries that we ship to, and I actually believe we ship to Croatia. Let me just check this for 1 second. So if I just go to Google and I type in equilibrium nutrition and I type in international shipping into Mr. Google or Mrs. Google, it should pull up a web page right there. Number 1, international shipping. It's amazing what Google can do, right? Is Croatia on there? It is not. All right, Croatia's not on there yet. We'll be shipping there one day. No doubt about it. We're trying to expand. If you have friends in Austria, Australia, Belgium, Canada, Denmark, France, the UK, Greece, Ireland, Italy, Mexico, the Netherlands, New Zealand, Norway, Puerto Rico, Switzerland, Sweden, or anywhere in the United States, they could ship these labs to you. You pay for it, ship it to a friend, they'll ship it to you. You just have to find for a way to get it back to the US. That's it. And then it gets shipped right to the labs. So you can do that. If not, you can begin the CBO protocol with the citracidal using the daily nutritional support as your morning breakfast. So you can do the protocol if you'd like, if you're not able to do the testing. Again, my job is to give people options and help you to the best of my ability. And that's how I can help you to the best of my ability. All right. Thank you, Ivana, for writing in. Cassidy is up next. Hi, Dr. Cabral. Can you talk about what supplements and dosing you give your kids daily and what you give them in dose when they are sick? Would you consider doing a podcast on children's health? I'd love to learn more how to support my 5-year-old's health. Can kids use all the same supplements as adults? I saw on your site there's a section for kids, but unsure of the dosages. Also, my 5-year-old is having intermittent headaches. She fell when she was 2 and had a CAT scan and was cleared. Anything you would recommend as far as testing for her and supplements? So appreciate everything you do. Thank you so much for changing the world. Thank you, Cassidy. I appreciate that. Okay, habit help. The first thing to do is this. Go to Stephen, just type into old Google again, stephencabral.com/podcasts. And in that search box, type in children immune. Let's find that together. I want to do it with you right here. I'm doing this in live time. Children immune, because I have not memorized all 1,255 shows either. So let's find out where it is. All right. So the Children's Immune Protocol is episode 858. The A to Z Children's Health Guide to Getting Well, Colds, Coughs, Fevers, Learning Disabilities, Immunity, Mood, and more. Okay? So that's a great starter show, I think, right there for you. One day I hope to sell a Children's Immune Protocol and an Adult Immune Protocol right on Equilibrium Nutrition. We're just having difficulty. We order large quantities, right? Because we're trying to get these products to people in 19 countries all over the world. So some of the companies we're working with right now aren't able to do the quantities, but we're trying our best. What can I tell you? Well, all the A to Z health stuff that I give my kids is right there. Like literally the Natronex. We're trying to get that under our brand. We're trying to create it ourselves so we can do it in mass quantity. The Sambucas Immune that I put in with them, and then the vitamin C. That's what they get for sure. Like that's what I do. I do vitamin D almost. They don't do it during the summer months for sure because they're outside every day getting a tan, but they will from October through essentially May for sure. So, I mean, we do everything when they're sick, like whatever they need. I've talked about the eye drops they've used before. I've talked about colloidal silver for pink eye that they've gotten for conjunctivitis. But on a daily basis, I keep it simple. I mean, just like, honestly, I use a decent amount of stuff, but my foundation never changes. It's foundational protocol level 3. My kids use daily foundational protocol level 2. They just use a smaller amount, So what do we get? Well, a little bit of probiotics, a little bit of omega-3. I use a liquid for them, and so they don't, have to do obviously the larger capsule. They use the daily fruit and vegetable blend, and they use the DNS. How much do they use? Okay, they use a half a scoop of the DNS powder. They use about quarter of the daily fruit and vegetable blend to a third. They use a quarter. Doesn't take a lot. About a quarter to a third of a teaspoon of the omega-3 liquid because it's concentrated. A full teaspoon would be for an adult. They weigh about 25% of an adult, which is why they use about 25% of the adult serving. And the probiotic, I simply add 1 capsule to their smoothie every morning. I keep it pretty simple. I mean, then they do the vitamin D on a daily basis. I give them a little extra vitamin C through November through essentially April. And then, of course, when they're sick, they get more of it. Yeah, that's it. That's what they get. All right. Hopefully that was helpful. Let's see who's up next. Cassidy has a second question. Hello. Can my 5-year-old daughter have the daily nutritional support shake, magnesium, omegas, and probiotics you sell? If so, can you tell me what dose of each she can have? Well, I can't tell you the exact dose. I haven't seen any of her labs, but she can absolutely use them. I kind of just gave you the dosage. My girls are 4 and 6 years old. They weigh about the same weight. So they both weigh in their mid-30s or so. And yeah, so that's what they use. The magnesium, all you do is open the capsules, and you can do that. How much do my girls get? Okay, my girls are off the wall at night. They get about 80 milligrams of magnesium after dinner. So there's that. The omegas, I told you how much they take of that. Same with the probiotics. I told you to take a half a capsule to a full capsule a day. Daily nutritional support, they take a half a scoop because they don't weigh 50 pounds yet. Then I would give them a third of a scoop. And remember, most adult dosages, when you divide it for kids, it's based on 150 pounds. It doesn't mean that if you're a 100-pound adult, you only take 2/3. You don't. You still take the full amount because you're an adult with a full liver capacity, all that. So for children, at 50 pounds, you do about a third. At 100 pounds, you do about 2/3. If they're under 16, if they're 16 or older, and they weigh more than 100 pounds, you can basically do adult dosages. At 30 pounds to 40 pounds or so, well, you're going to do about, I do about a quarter of the dosage for my girls. Okay, hopefully that helps. Great questions. Luke is up next. Do we have another time? Yes, let's do one more question with Luke. Dr. Ball, thanks very much for answering my previous question on your daily house call. I suffered a severe knee injury 3 years ago where I snapped my ACL, MCL, and had meniscus tearing. I rehabbed this without surgery and have since returned to sport. Just recently, I've twisted my knee again due to lack of stability without an ACL. I've again sustained damage to my meniscus. I don't have surgery. I don't want to have surgery, but this looks like the only option for me to return to sports. I have 2 questions. Is there anything else you know of that I can heal my ACL without surgery, or any other remedies I could try? If surgery is the only option, what should I do before and after this, my body go through it to do my best to help things heal naturally? Thanks again, Luke. Luke, this is a great question. This is one of those times where, it is tough because sometimes surgery is warranted. And I'll never say that that's not always the case. Sometimes it is. But yeah, then you have to what? You have to do anesthesia. And you might have to take antibiotics. And that's not great, right? It's not great for the gut, and it's not great for the liver and kidneys when you're doing anesthesia. So what you do is you do your best, right? That's all you can do in life is you do your best. So here's the thing. Okay, it depends on the level of tearing for your ACL. I'm not a sports doctor. I'm not an orthopedic doctor. I'm not an orthopedic surgeon. I don't specialize in that. And I always tell you that ahead of time. However, I have colleagues that are orthopedic doctors. And I also work with a lot of athletes. Here's a couple things that have worked. Depending on the level of the tear. If it's greater than 60 to 70% tear, sometimes surgery ends up being the best option, but usually people give themselves 6 months to really try the natural option. I talked about this a little on Friday's podcast about as a hair loss treatment, platelet-rich plasma therapy, PRP, as well as stem cells injected directly into the site can oftentimes be pretty amazing. Combine that with vitamin C, zinc, glutamine, and collagen, advanced collagen support. Of course, do your daily foundation. And whenever I mention individual supplements, I'm assuming you're doing daily foundational protocol level 2 or level 3. I mean, don't even worry. Honestly, like people talking about PQQ and DPP4 for an enzyme and nattokinase, and they're all great. Don't get me wrong. Love them all. Love ubiquinol. Love this. Love all these different things. But they don't matter if you don't have a foundation, right? You need all your vitamins and minerals and essential fatty acids, all those things first, right? So that's most important. Then you can do add-ons. So Luke, like if it was me, this is what I would do. I would absolutely do my rehab, stabilize the perineal muscles, stabilizing the IT bands and, the vastus lateralis or lateralis, however you like to pronounce it. I'd keep doing all that work, right? For sure. I'd immobilize that knee to make sure I don't make it worse for now. I would use maybe natural anti-inflammatories like boswellia. Things like bromelain are also fantastic. What else would I do? And then I would look to doing the platelet-rich plasma therapy. And I would look into the stem cell treatment. That's what I would do, but it doesn't mean that I don't know the degree of the tear and I don't know how quick you want to get back to sports. I mean, if you're a professional athlete and it was more than 60, 70%, they're going to say, hey, you're either going to use part of the hamstring, you're going to use a cadaver ACL, you're going to use something to rebuild that. So again, I don't know the level of professional athlete you are. I don't know the level of what you're going to need, but at least I gave you a couple different scenarios and hopefully that was helpful. Luke, thanks so much for writing in. Thank you everybody today for listening to another Cabral House Call. As always, if anything was helpful for anyone that you know that could use this information, please do feel free to pass it along to them. Have an amazing day. Thank you again and take care. I'll see you tomorrow on our Motivation and Mindset Monday. Don't miss it. Are you ready to heal yourself and then go on to heal others? If so, the Integrative Health Practitioner Institute can help you discover proven functional medicine protocols that blend the best of 7 different healing disciplines from around the world. I personally share with you the exact handouts and protocols I use in my private practice that enable people to get well, lose the weight, and live longer, stronger. I want to pass this information on to the next generation of health coaches, and that is exactly why I created IHP. We are the future of the health coaching industry, and the skills and knowledge you will learn will make you an in-demand certified health coach anywhere in the world. Although we have many medical professionals taking the IHP certifications, no experience is necessary, and half our members have no previous health certifications. At the Integrative Health Practitioner Institute, our motto is a health coach in every home. Our goal is that you take this knowledge and then share it with family, friends, loved ones, your community, or in a practice where you create a career you love and can be proud of. The global IHP community is filled with some of the most kind and caring people in the world, and we can't wait to welcome you into our world soon. For more information or to set up a discovery call with one of our IHP Health Coach graduates, simply head over to integrativehealthpractitioner.org.